Now that we've given people a couple minutes to join in onto the webinar, we should be good to go. As you can see, tonight's webinar is the first in our series on cancer survivorship, which is often considered in the medical community as almost an under-addressed aspect of care, which is why we have Prof. Ben, who is starting off this new initiative, driving the idea of survivorship going forward. We have three speakers tonight: Professor Carol Ben, who's the head of the Breast Care Center of Excellence, Dr. Elizabeth Hart and Lorna McCrintle, who are here to join us as specialists within their field of survivorship, and they lead the Breast Care Center of Excellence's survivorship team. I'm going to give this opportunity for all of our speakers to introduce themselves, starting with Prof. Ben, even though we all know her very well. Please, can you kick us off, Prof, before we move on to Dr. Hart and Lorna McCrindle to introduce for us.
Right. Okay. So thank you very much. Thank you to the team. I really don't want to introduce myself because this is not really about me, but it's about a concept that I think is so underutilized. Going through any chronic disease, particularly cancer, is really, really difficult for people from a treatment point of view. And whereas I don't really like the word survivorship, it always reminds me of that Gloria Gaynor song, I will survive. I feel like I get there at the end of my day. Having treatment, with it comes a whole lot of other aspects around healthcare that are often not addressed. Managing the side effects and the sequelae of the treatment, managing mental health issues, managing physical issues around it. And it's really about people having emotional and physical well-being while going through a chronic disease process. So for me, it's about illness to wellness. It's about having a spectacular team. And so I thank them very, very much. We've been involved in survivorship in the unit for the last 10 years, but it's really the first time ever that we've had such a drive where we understand from rehabilitation, diagnosis through treatment, and managing medication there afterwards, making choices, that we've had a team that's here to help patients. For me, this is not about a replacement for a clinical consultation. It's about taking topics, and I'm going to suggest that if people have other topics, that maybe they email them to one of the members in the team, or maybe Tanya at BCCE, we can give to look at further topics going forward that we can work and sort funding for, where we can get different specialists from around the world to help out and answer these questions. Remember that each person and each one of us comes with our own opinions and ideas, okay? And whereas there is not one solution for everybody, it's about listening and sharing knowledge. And as we share knowledge together, we actually work out better ways to manage things. So the last thing I want to end off with is, I think I'm going to fund the first one, but we're going to look for funding to cover the IT and the management issues, so these can be cleaned and loaded up from a website point of view, and other people can access it when they hear about it. So anyone who's interested in sponsoring one of these sessions can contact in, I think, Dominic, with you directly. So I'm going to leave it at that. I'm going to switch my camera off, my mic off. I'm going to listen. I'm here for clinical questions and answers. If I have them, I'll give them. If I don't, we'll definitely work out where to find them. So thank you again, Dominic. Thank you
Thanks,
very,
Prof.
very
Ben.
much to Dr. McCrindle and Dr. Hart for ensuring that we have such a good survivorship program in the unit. Thank you.
Thanks, Prof. Ben. But before you head off too far, I am going to say there will be one or two more comments for you before we fully hand over to Dr. Hart and Dr. McCrindle. But on that note, Dr. Hart, do you want to introduce yourself and your position within the survivorship program?
Yes, thanks so much, Dom. And I really am so grateful to Professor Ben. She has had the vision for this for a long time. And I don't think there's anyone in South Africa that's doing, as much as we are doing. And it's super exciting for me to be involved. I'm a medical doctor by training. I was a GP for a while, and then for the last many years, I've been working in the breast care unit, mainly in surgery as an assistant surgeon. And then 3 years ago, I did a functional medicine coaching course, which was a year-long course. And then I did the American board exam, the National Board of Health and Wellness Coaches in the States. And so I'm a board certified health coach as well. And really, I think that's when Professor Ben and I started talking a little bit more about how I could get involved in survivorship. I really, so my role in the unit is more on the coaching side of things, and coaching is hugely different to being a diagnostician and a normal medical person. And it took me a while to make the shift, because as clinicians, we taught to sort of speak to somebody, make a diagnosis, prescribe a treatment, and that's that. Whereas a coach is way more on the patient, like a patient ally, and someone who is helping the patient find their own solutions to things. So it's a completely different approach, and I really love it, and I find it a huge privilege to actually play that role with people who need that.
Thank you so much, Dr. Hart. And last but not least, let's have our third specialist, Dr. Lorna McCrindle. Do you want to introduce yourself and your role within the survivorship program? Dr. McCrindle, I believe you may be muted there.
My apologies. So I'm Lorna. Yeah, I am a specialist family physician. So I run a private family practice. And about 4 years ago, I got involved with the Breast Care Centre of Excellence with Professor Ben. And I have I do all types of different types of medicine, but I have a special interest in breast cancer and breast cancer survivors, as well as in sleep medicine. So about 4 years ago, I got involved with the Breast Care Centre, also working as an assistant surgeon, but then I got involved in the perioperative care of the patients as well. So I see breast cancer patients ahead of surgery, in looking at their fitness for surgery, their other chronic illnesses, their mental health states, and just a bit of an assessment ahead of the big op. Then I got more involved in seeing the survivors, realizing that this is a huge field of patients that are often left to, once they leave the active oncology treatment team, go back to their general practitioners, and maybe those doctors are not well enough equipped to manage some of the ongoing problems, health issues that breast cancer survivors face. And I'll elaborate on those a little bit later. So I'm involved in the medical side of managing the survivors' health conditions. And that may be medical or mental, and obviously I refer when necessary. I also have a love for sleep medicine and healthy sleep. So I will elaborate as well a bit later about how that fits into a breast cancer survivor's journey as well. So yeah, that's who I am.
Thank you so much, Dr. McCrindle. I'm going to take this opportunity to remind everyone who's here listening tonight that you're welcome to post your comments and questions into chat, and we will address them. Following that, I'm going to split tonight's discussion into a couple different aspects. I'm going to focus first on the definition of survivorship, and from a medical perspective, what we feel needs to be achieved and where it's come in the last couple years of development into an active part of cancer care. After that, we're going to lead on to a couple more specific questions and maybe some advice that we can give to the listeners tonight in terms of specific issues that survivorship can address for them. So to kick it off, I do hope Professor Ben is still here just for a little bit longer so that we can have her comments come into it. And we're asking the big question of defining survivorship, and I'd like that to come from each of your individual roles. Professor Ben, as an oncologist, specifically addressing the patients, perhaps you can kick us off by answering, what is your experience with patients who receive support through survivorship versus those who don't?
So it's a very, very important topic, and I'm going to break it into two. So survivorship starts almost with prehabilitation. Going through a diagnosis creates significant trauma. You're taking about 20% of what your doctor tells you. You need to ensure there's a multidisciplinary approach to it. Sometimes people are referred into oncology. Sometimes they're referred into surgery. Sometimes people are like, I don't understand why I'm going in this different direction. Then there's a part which is active treatment, and active treatment requires different types of support, both medically and from a life coach point of view, to manage either going through chemo, going through surgery, going through endocrine treatment, and each person is an individual. So you come in with your own individual health concerns. You have a biological and a physiological age. You come in with a different family, personal background. So whether you're 23 and diagnosed or whether you are 88 and diagnosed, you're going to come in with different issues that we need to take into account. Then once we have a treatment plan and you have your active treatment, afterwards, a lot of people are on chronic medication. And chronic medication comes with potential problems and concerns. How do we ensure compliance? How do we deal with issues such as menopause? I've been in menopause since, what do they always say? My youngest child broke me. Okay. So now how do you as a young woman have to deal with menopause, your physical, your sexual aspects of your relationship, etc.? Those are difficult things to do. And the continual fear of the fact that you've almost had a rattle of your cage, that something is trying to break in, and this continual cancer fear. How do you deal with this? So I think, Dom, you could probably even mention better than me, but recently I think you gave the presentation at the American College of Surgeons. It was an abstract that we wrote based on the work that Lorna does in terms of rehabilitation, time to surgery, and outcomes from a hospital point of view. Well set up. We've got Dr. Vandenberg, who's really, really good with systems. And what it showed that there is decreased time in hospital, surgery, better outcomes. Okay. I'm looking forward to presenting. Hopefully Liz can present some of her amazing work done next year in the US. But for me, patients who have full medical and emotional support throughout their journey do better. There is no question, from a compliance issue, from a decreased time in hospital, from an outcomes, from a recognizing potential problems and managing them. There we go. So I'm not here, but I want this to be about these amazing ladies and what they're going to do and set forward. And every webinar I'll be on, very much in the background, just to anyway assist in any way I can. Okay.
Thank you very much, Prof. Ben, and that is definitely understood. And yes, the presentation was this year at the National Cancer Centers Network, where it got a top 50 award for discussion on survivorship and the benefits of survivorship amongst oncology treatment. Next, Dr. McCrindle, I'd like to get your opinion on survivorship and the changing role of survivorship over the last 5 or 10 years. And you specifically mentioned your focus on sleep medicine. And I know you did have a role in the South African Sleep Lab. So I'd love you to include a little bit of aspect on diagnostic sleep disorders, specifically for survivorships, whether that's different amongst other patients or breast cancer patients.
Yeah, Dom. So I am, as I said, I've been in this field only for 4 years. So I'm, learning all the time myself. But I have seen the huge need for breast cancer survivors in terms of their health, ongoing health issues. And as we mentioned, that can be just help managing the long-term effects of cancer treatment, particularly the hormone blockers or chronic pain or neuropathies or all the things that the hormone blockers can cause. Patients often need an ear and a mind that really does understand why this is absolutely essential to preventing recurrence, but at the same time managing their quality of life and being able to offer some solutions to help these side effects so that the patients continue with quality of life. The breast cancer survivors have also obviously other chronic illnesses that need addressing, and their diabetes and their hypertension. And it's nice that they have a provider, maybe a primary care physician like myself, or who can actually manage all these different aspects of their care. I've obviously seen a huge need for mental health care. As Prof. Ben mentioned, along with surviving cancer comes anxiety and depression and post-traumatic stress, things that that will often be with them unless they are managed well through therapy, medication, social support, because of this ongoing fear of cancer recurrence. I also see that promoting general well-being, general health is also important. You know, we want to help people stop smoking. We want to help people manage their weight. We know smoking and being overweight are risk factors for breast cancer. So, and as I mentioned, sleep. Which I'll come back to, just promoting healthy sleep and healthy sleep behaviors. The last area that I think is part of my role is just the ongoing surveillance for cancer recurrence, whether that's in the breast or whether it's new cancers, and ensuring patients do follow up with their gynecologists, do regular mammograms, colonoscopies as needed, etc. So I just wanted to mention sleep. So there's growing evidence as to the overwhelming benefits of sleep, and in both the physical body and our emotional and mental state, and that is far-reaching, from metabolic health to weight management to cardiovascular risk. Not to mention sort of mental health disorders that are worsened by poor quality of sleep. And the breast cancer survivor has a few reasons why they may struggle with sleep. To mention a couple, obviously mental health struggles and anxiety and stress causing insomnia. Depression can cause too much sleep. Then there's obviously the effects of the hormone blockers. So declining estrogen levels impacts sleep significantly, with either difficulty falling asleep or difficulty maintaining sleep. Then weight gain, which can happen due to hormone blockade therapy. It can also happen just due to natural aging. And this puts women and men at greater risk of snoring and obstructive sleep apnea, which is a hugely undiagnosed condition. And obstructive sleep apnea profoundly impairs sleep, leading to, as I mentioned, cardiovascular disorders, being overweight, depression, car accidents, sort of very serious things. So wow. There's a lot of reasons for breast cancer survivors to have their sleep addressed. And it's not just a prescription for sleeping pills. That's not the solution. There is approaches to insomnia and hypersomnia and obstructive sleep apnea. So I am involved in a sleep laboratory where we do testing, and we do a lot of counseling and a lot of management of sleep disorders.
Seems like it really does cover a huge, broad range of aspects of life, and survivorship can help address that. And from yourself, Dr. Hart, as a survivorship coach.
I'm just going to say, recently in the last week, there have been 3 articles addressing the significant impact on sleep and lack of good sleep causing cancer. And I know it's a big thing that Liz talks about as well. So there we go.
No, that's definitely very interesting. Dr. Hart, from your role as a survivorship coach, how does the role of a coach in the program differ from the normal oncology team?
Yeah, that is the key question, Dom, and that's sort of me trying to define my role, really. I think Carol, Professor Ben always talks about us as the glue, but we glue in different ways. So as a coach, I'm a functional medicine trained coach. So I look very much at people's lifestyle, because that's really where we're in functional medicine. That's where we start. That's the basis of everything. You know, if you want to diminish risk of disease and you want to manage disease better, you have to start with lifestyle. And there are 5 major lifestyle factors that we look at. the first one is nutrition, then there's exercise and movement, there's sleep, as Lorna has spoken about, there is stress management, and then the last one is relationships and community. So I very much look at all 5 of those, and I add into that past trauma that we also need to look at. And so I deal with the 6 kind of what I call the 6 pillars or the 6 roots, and that's what I focus a lot of my time on with people, because what we found is that if we can get those optimized, if you can optimize your lifestyle, you quite often deal with the treatments that you're having to go through, these really, really serious cancer oncology treatments. You deal with them better because you're just healthier generally, and then you recover better afterwards, and you deal better with the side effects going forward, even with things like hormone blockers, etc. So from a coaching point of view, as I said at the beginning, you know, I'm a coach, so I'm very much, I'm not a clinician. I'm not prescribing stuff necessarily. I mean, I do sometimes because I'm a doctor and I can, kind of thing, but I'm much more, you know, on the patient's kind of trying to be the patient's ally and help them kind of find their own solutions. That's very much what coaching is about, is helping you work through those 6 pillars and working out your own solutions for them. So that's kind of where I see a lot of my role. The other thing I focus quite a lot on, and what I want to try and expand on, is helping people navigate this kind of quagmire out there of all sorts of misinformation. So there's a lot of I focus a lot on much on, as I said, on lifestyle, on more natural therapies, on supplements, and all sorts of things that I do look at. But you know, there's lots of misinformation out there, and I really think we really want to be a source of proven scientific based information. And I see my role a lot as sort of sifting through that and helping people find real solutions that actually work and that are scientifically based and are not going to interfere with their oncology treatment. You know, the oncologists are so busy trying to just treat this cancer. I mean, it's a huge job, and that's what they've got to be focused on. So Lorna and I are really there to kind of fill in all the other gaps, because you know, the oncology team just doesn't have time for all of that.
Thank you so much for that. And that gives us a very clear understanding of where everyone's roles comes into survivorship and the vast aspect of topics that survivorship does address within this care. I'm going to ask a quick question from the chat before we move on to a little bit more deep dive into survivorship. There is a question about, can we get any references or link to those articles that I think Professor Ben mentioned specifically regarding sleep and cancer? So I don't know if you, Dr. McCrindle, has any access or references for that, or Professor Ben can send it through and we can link it to the chat so they can look into that a little bit deeper.
And Dom, being head of accreditation and being like the IT guru, I'm going to sit with you and show you where they are, and then you can load them up and send them. Okay.
Thank you very much for that, Prof.
Okay. Well, yeah.
Continuing the discussion on survivorship, I want to have a bit of a discussion now on some of the misconceptions and almost unseen benefits that survivorship come through. So let's open it into a discussion between everyone, and we say, as a survivorship coach, Dr. Harton, someone who assists people both on prehabilitation and rehabilitation, are there any aspects of survivorships that patients come to you and you find that they're almost underinformed about? They don't know that that could be an aspect of survivorship or some assistance that you provide for them. What would you say the most common benefit that they find out survivorship gives them would be?
It's interesting. I think a lot of people come to me because they realize that there are things that they can do to improve their outcomes. You know, and they start by asking questions, especially on things like nutrition and exercise. Those are the kind of commonest questions that I get. And then I start dealing with all 6 pillars, and we always end up in the emotional aspects, actually, because that affects everything. And of course, cancer is a hugely mentally and emotionally challenging journey. and we can all do with better techniques and of dealing with those challenges. So I deal with those kind of things quite a lot. Yes.
You know what? I've said for years that there's a relationship between stress and cancer. And I give the blunt explanation. It's like the tumor microenvironment. And Dom will tell you I'm busy with another PhD. You've heard me killing my life, right? Okay. So I'll come to speak to you about stress. So the issue is the microenvironment. Cells are undergoing change all the time, and the little hyena cells are the reason why some people can have genetic predisposition and not get a cancer, and 65% of people who don't have a risk factor get a cancer. But for the first time ever, and I've always been embarrassed to say I see stressors in people's lives and then I see a cancer a year or two later, because it sounds so like just flim flam, right? But it's true. And now we're starting to see presentations coming out of the US and coming out of Europe about stress and cancer. So I don't know, who knows? You work really hard, you go on holiday, you get a cold. It's the same concept, okay? So I don't think we have answers. I think we're waiting on all the clever scientists. And I know that stress is a part of everyone's lives. But if we can just work out small ways with the help of people around us, community. So thank you, Liz, for getting me into Pilates. We'll touch my toes by the end of the year. And trying to work out how we can decrease stress, whether it's better sleep is a good place to start. So there we go. All right.
Yeah. No, absolutely. Stress is hugely, I mean, the number of women I see who, lost their husband during COVID, for example, and now 3 years later, they've got a breast cancer. That happens, but, stress is kind of, is part of life, isn't it? But we can all learn better ways of dealing with it. We can all learn ways of managing that stress and navigating it better to minimize the effects on our bodies. If you just look at what happens to your body under stress and what happens to the hormone levels and the cortisol and all those sort of things, it's kind of obvious. You precipitate this inflammation in your body, and we know that cancer is an inflammatory disease. So yeah, stress is definitely, we've said it for years, but actually we do have proof.
Very much so. Dr. McCrindle, I don't know if you want to add any comments there on that discussion.
I do completely agree with stress and trying to find ways within your life and the demands on your life, how to manage it a bit better. I love using that urgent and important table with patients. What is urgent, what is not urgent, what is important, what is not important, and then we've got so much going on in life, but what can we delegate, what can we put aside, what can we ignore, and what do we need to act on, because we all feel that constant juggle of things. But I also just wanted to say, I find when I see patients after a cancer journey or even in it, because I am involved in the perioperative time, communication. Sometimes patients just feel like Professor Ben mentioned, patients take in 20% of what we tell them. And I often see patients who have got so many questions, and I think, haven't you read your stuff? And we know we were giving you tons of information, and we explained how your operation's going to go, but they just need it repeated. And it goes the same when they're starting on longer term hormone therapy, or they've got pain or discomfort post radiation, and they just didn't feel like it was communicated properly. And I know our consultants, and I know our specialists, and they do communicate, but patients just don't take it all in. So I think often we're just having to repeat and reassure and remind and say that we're here, because if you've still got questions, see me next week again. So I think we're that space where patients, we maybe have a bit more time to offer patients. And we are, because Liz and I have been involved in the active cancer treatment parts as well, we're able to offer some support and input there as well. But yeah, I think people need to talk. and we're here for that too.
Thank you
Well,
very much for
I
that.
think you have insight. You have insight. I always say when you find out who nursing staff refer to and anesthetics, it's who they've seen and worked with and seen around surgery and medical. So you have insight, but you are most definitely the glue that holds things together. And no matter how busy specialists are, we still need to explain things properly. And I'm often told that my brain is so busy and I'm doing many things that people are like, oh, what exactly was she saying? Okay. So sometimes hearing it a different way, we either take things in verbally or we take things in by pictures. And it's our responsibility medically to make sure that whatever the medium is, people can understand what the message is. Because the last thing we want is someone to rush into a treatment without understanding. Consent is a big thing for me. What you're doing, what you're getting involved in, etc. And I think, Liz, you are also very clear on that. And that's when you're stressed, you can't really, how can you consent?
Yeah.
Thank you very much for that. Dr. McCrindle, you mentioned a very interesting aspect there, was how you're involved with not just the traditional thought of survivorship, but also the perioperative aspect as well. And that brings into mind for me a new word that has been thrown around a little bit. And I'm not sure whether it's officially accepted as a word now or soon will be, but that is prehabilitation. What is the difference between rehabilitation and survivorship in a more traditional sense that I've heard of before and aware of, and this new concept of prehabilitation?
I think prehabilitation is obviously the before. It's before you have an insult on your body, and just preparing your mind and your body for that insult. And so ideally, we want you in good health before you enter, I mean, ideally, before you get diagnosed with cancer. But obviously, we're not involved in lives there necessarily. But we want you to be an optimal weight. We want you to be active. We want you to have if you have any chronic illnesses, we want them to be well controlled, with minimal sort of sequelae or consequences of those illnesses. We want you to be mentally in a place where you are sort of going at a thinking pace and understanding what's happening and who to lean on and what support is available. So we want people as we know they've been diagnosed with cancer, we know that they are probably already on some kind of cancer treatment ahead of surgery, which is the big insult. And we want them well going into it. And then, as Liz mentioned, we know that they will get through it better. I see patients who have maybe completed 6 months of chemotherapy and then they are due to have surgery for their breast cancer. And the patients who have really tried to maintain a healthy lifestyle even through chemo, and that can just be a gentle walk every day. It's eating nutritionally. It's making sure that they're sleeping. It's managing the stress that they can manage. Those patients are much better prepared as they enter surgery. And we know that they'll come out the other side. I don't mean out of the operating room, but I mean out of the surgery insult better. And therefore their rehab will be easier. So that's quite important. And unfortunately, I'm involved sort of in the finish my chemo or finish some treatment and then go to surgery, and they see me to assess how fit they are, which gives me an opportunity to make a difference within 1 or 2 weeks. But ideally, we actually would like to be, like Liz mentioned, coaching patients through the cancer journey. So survivorship is not necessarily just once you're a survivor, once you have made it through, but actually it's something that can be prehabilitated. So we can get involved with lifestyle and health coaching and optimizing your weight and your movement and your eating while you go through cancer treatment.
Thank you very much for that. Dr. Hart, is there anything you'd like to contribute?
Um, yes, I definitely look. I think survivorship was first actually defined in the 1980s, so that was 40 years ago. And the official kind of description of it is or definition is that it starts on the day of diagnosis and then continues for the rest of that person's life. Because you're always potentially dealing with, with the fact that you've been you've had a cancer at some point. So I think, for me, I would love to be involved with every patient from the day they're diagnosed, because must be one of the scariest days of their lives. And it would be wonderful to sort of be involved from then. So Professor Ben has referred me patients at all different stages. And so I do see some people pretty early on. And I think, as Dr. McCrindle was saying, it's actually beneficial to actually talk to somebody like one of us, perhaps early on, and just make sure your health is optimized, etc., right early on, because it's going to make a huge difference to your long-term outcomes and the way you handle this quite intense year or so of cancer treatment.
So you see, I think this is where I'm gonna be that nutty professor, but this is where yeah, there's such opportunity for everybody. And I mention it often in theatre, there's an opportunity for apps. We all come in with different personalities, we all come in with different health things, so that you can do some form of assessment of a needs analysis for anyone going through once you've got a diagnosis. So that for me is critical, because it's a personalized journey for people, and that everyone has a personalized needs. And then you spit out the other side, and then each person has different side effects going forward, including lifestyle and health, general health, as well as managing side effects of treatment. So it's not one size fits all. So I'm going to hand it to the IT team. There's such need for people to get involved in setting up these things in this clever world we have today. There really has to be ways that we can offer something to people where we say, hold on a minute, this is your needs analysis. And because I have this, everyone goes, well, you work all the time, because it's just not because I want to see everybody, but I have such anxiety, as you know, around when I see things like people who have cancers that have gone through multiple treatment processes and no one's done a repeat biopsy or a liquid biopsy or something. And I just think, oh, why haven't they accessed an MDM? Why has no one spoken to this person? And I do think that survivorship sometimes gets worse when people are in a metastatic setting, when the cancers come back and they maybe need more help. That's when the doctors don't quite know what to say, and the patients are actually more alone. So, like I said, the glue, and well, lots we've got to do here.
Thank you very much, Prof. And your comments actually echo a question that has just come through from the chat as well, about how we can utilize telemedicine platforms to enhance this idea of cancer survivorship support. That mentioned comments such as turning these educational webinar aspects into something that is practical in everyday solutions. What I'd like to get your opinion on, both Dr. Hart and Dr. McCrindle, is where that potential could be in the balance between having to see someone in person in a clinical setting versus being able to speak to someone in a virtual telemedicine aspect. What would the limitations or the benefits or cost benefit way off there be?
There's never a limitation. People must
Mm.
come together and try and work out solutions. And there are loads of them. There are loads of them.
Yeah,
So I think it's really.
Mm. I do a lot of online consultation, and it's easy for me as a health coach to do that, actually. Lorna's job is a little harder, I think, remotely, depending on what she's dealing with specifically. But I think there's a lot that we can do online. And really, Lorna and I think, see this ongoing set. We're going to be doing one of these webinars monthly. And so we want to, educate people. We want to give people the right information. We want to give people an opportunity to ask their questions online and get them answered, etc. in a group. This is a group setting, obviously, but of course that can then lead to something that's more one-on-one if that's what's needed. So we see this as the beginning of that. But we really are at the beginning of a journey. We're learning every single day ourselves, and trying to work out what it is that people really need, and we want to fulfill those needs for sure.
Yeah, and we also recognize that the centre where we are working, primarily at Mill Park Hospital, our patients come from far and wide. So it's very much necessary that we do telemedicine consults. And like if we give a whole lot of information through this sort of channel, then the consults can really be focused. Patients can say, listen, I've heard you speak about that. I think I'm struggling with that. What do you think? So a lot can be done virtually. I obviously, there are some occasions I do some telemedicine at the moment, but there are some occasions where I need to examine the patient, and in that situation, would need someone to come in and see me. But a lot of what we are talking about in terms of this kind of just general health promotion, managing side effects, those type of things, those can be managed virtually.
Absolutely.
Thank you very much for that. That's definitely an important aspect to address and discuss there. And it brings in the concern to my head that unfortunately, as much as we can assist with these type of programs and the telemedicine aspect, and as Prof. Penn would do it, try and squeeze some more hours into the day, it does reach a stage where there's only so many people you can see at a certain amount of time and so many personalized programs you can do. Are there any sort of general advice you'd give out there for survivorship or someone who's undergoing cancer treatment, such as are there any lifestyle integrations that you have found to be most effective in supporting the health and wellness of survivors?
Oh, that's a big question, Dom. I just go back to the 6 pillars, really. Nutrition, exercise and movement, sleep, stress management, relationships, community, and dealing with past trauma. You've got to deal with all those things. And quite often you need help dealing with them. They're often not things you can do, yourself. But I do think it's important to remember to look after yourself, and remember that this cancer journey is incredibly challenging. And you almost have to take a step back and be a little selfish here, because you can't do what you used to do before. If you're a busy mom, for example, looking after children, maybe working as well and doing all of that sort of thing, you have to take a little step back from that and actually realize what your limitations are here, and actually give yourself grace for that, because it's an incredibly challenging journey on so many levels. And women struggle so much with trying to balance all those things and think they have to just power through, and carry on doing what they were doing. And no, actually, no, you need to, as I say, give yourself a bit of grace and take a step back and give yourself time to process all of this. I don't know if you were going to ask this question. It's just occurred to me. I wanted to bring up the fact that there are caregivers in this situation as well, and they have their own challenges. And so, I'm here for those people too. We are here for those people too. Maybe a caregiver that wants some answers about how to support their partner best, as well, because it's a very challenging journey for a whole family or community to go through often.
100%. So I think for me, setting up a webinar series and getting people to talk around different topics allows people to realize what their concerns are. So there are many things we can do. Dom and myself have had meetings around you guys running survivorship training courses for GPs that can contact in with you around, so that we reach more people. And like I said, each person's journey is individual, as is their side effects, as is the issues that they deal. There are huge issues about understanding the impact on cancer on families and children. I've often mentioned setting up a cool club, children, and how you manage it. I think 2 Fridays nights ago, I spoke about books and reading and access to things that explain things to kids whose parents are going through cancer. So the world is a great and amazing place for ideas and for improving things. And together we can do this, okay? It's a very Mandela quote, and it's just coming off Mandela Day. But I think that, yeah, super important. So I will let you guys continue. Charles brought me some food.
Thank you so much, Prof.
Dominic, just one, when you asked about what is a piece of advice that we could give, sort of one thing, I would say that it's really identifying people who are going to walk this journey with you, and that, you know, unfortunately, when somebody gets diagnosed with cancer, people seem to do different things. Some people will lean in and support and love and care and dote, and others will actually withdraw because it is a scary thing, and it's they don't know what to do, they don't know what to say. So you may have some friends sort of leave you, and then you'll have others that will lean in. And I think not everybody has a huge social support, not everybody is in a lovely family. So whatever that looks like for an individual, and it might be a church member, it might be somebody else who's in the chemo lounge with you, it might be distant friends who come back onto the scene when they realize, hey, I heard you've got cancer, I've been there too. And it might be your spouse, it might be your sister or your brother. And it's just identifying those people early on who are just willing to walk the journey with you, because you cannot do this alone. There are so many difficult things to face, and it's just, no one should have to do it alone. So I think identifying those people and approaching them and leaning in is critical in this.
That is such a
Yeah,
good comment, Dr.
I think
McCandle.
that's
I do
absolutely
appreciate that.
excellent. Dom, I want to talk about two things. I want to stop into Liz mentioned the concept of you're not the same. And I mean, I've written on the concept. It's a bit like that. Is it Captain Marvel? You have a blast. You've got your old jacket from the past and the new you, and it's trying to fit that in with your life and your people around you, etc. Really, really important. And then in terms of Lorna, what you said, it's critical to find your support team. I call it your ghost busting team. And they're good people to ghost bust. And then there are also those things, like I told my kids, I don't know if they listened, be careful what you put into your head. So sometimes if you continue Google and chat rooms and this and that, you pick up things that make you more anxious and more scared. It's like, I don't do horror movies, okay? Because then you just think everything's rattling in your head all the time. So you have to be really, really careful. And that is where you guys are critical. Your survivorship doctor specialist team can help you sift from what is sensible to what is not. Okay, so there we go. That's my take on you guys.
Thank you so much for that and for those comments. And Dr. Hart, you definitely brought up an aspect that I do want to speak about tonight. While we're having this initial webinar is now introduction to a survivorship series, and we are intending to have many talks in the upcoming weeks. I think we're even planning to have another one just 2 weeks away from now on these 6 pillars that you suggested. I think that there are some further topics that we can address and have as these
Definitely.
all different topics, and we welcome people in our chat to make suggestions. I can see that a couple suggestions have even come through that I will address now, and let's interact a little bit with our chat of what come through. I see someone asked a specific question on where we can get additional information such as links, and we will ensure that in future webinars we can provide them. They also asked the question of how to talk to children about cancer, and I assume that will even go further on to other family members. And I'm going to suggest that we include that as a topic on a future webinar of where we can have that discussion as well. I also have a further comment that came earlier from someone who is a survivor herself from Prof. Ben and the BCCE, and they asked a number of questions that we can address. And you're welcome to answer any of these shortly now, but we'll keep them as future topic ideas going forward. They asked about alternative medicine in treating cancer, as well as traditional healers in treating cancer and how to address that. There was also questions that came through about hereditary cancer in the Black and marginalized communities, where they don't have the family history that most people have or that they're asked of when they go for these clinical examinations. Do you want to make any comments on those aspects of the chat before I want to go and address one or two direct, almost treatment advice from one or two people in the chat?
Yeah, I think, the alternative medicine thing is very broad, because what is alternative medicine really? And as I said earlier on, I think we want to really make sure that we're a good source of information on all the alternatives, whatever they may be, because what I've always admired Professor Ben for is her openness to hear all sorts of different things about different, potential treatments and different ways of managing side effects, et cetera, et cetera. She's completely open about that, whereas a lot of clinicians are extremely threatened by those kind of things. So, we certainly want to be a source of really good information on whatever so-called alternative treatments there are. I don't know, Lorna, if you want to say
So
something
for me,
too.
alternative is something. What's alternative?
Yeah.
How you dress, how you this, how you that. So I'd rather know what people want to take and then try and work out what the research behind it is.
Exactly.
Everything is a poison and everything's a medicine in different doses. And it's about how things work together. So I'd rather we complement and we work together rather than work apart, because you either take one road, the wrong road, you have a crash and you come back. So we want to have some form of communication about hearing what's in people's head and what they want to do. For me, traditional medicines or spiritual, anything that's part of your life is important. So to work together with people, whether it's your Chinese medicine specialist, your homeopathy, or etc., is important, because by working together, we help take into what is critical for people to make sure we have better outcomes, as opposed to just going my way or the highway. I mean, the medicines that have been around since, I'm old, but for many centuries, right?
Thanks so much, Prof. Ben. I think we can take a bit of time now and address some direct comments, because it's starting to flow in about people asking for advice and opinions going forward. And Prof, while you're on the line, I believe I could get your assistance on this first question. What advice would you offer to a patient who is stage 4 taking chemo medications for life? Do you have any good suggestions or feedbacks that come through there? And I believe I would need your interpretation as to what medications they'd be on a chronic aspect.
So I don't even think I'm going to go through that. I'm going to, in terms of their medication, but I'm going to talk around and say that if you're a child and you're diagnosed with insulin-dependent diabetic, did I say the right word? Type 1, right? Okay. Don't even know they do type 1 anymore. Then you need to be on insulin for life. If you are a familial hypertensive, Lorna, you're going to crack me on some of these, or you've got like familial cholesterol, you need to be on medicines for life. And statins per se can have hectic side effects in terms of aches and pains in liver, etc. If you are diagnosed with HIV, or if you have a significant mental health issues, you may need to be on medicines for life. So sometimes there are medicines that we need to be on for life, and sometimes there are medicines that we don't need to be on for life. And if it is something that you need to be on to maintain the status quo in your life, then you need to have a survivorship specialist team to make sure you manage the side effects thereof. I think that for me is really important, whatever you're on. Okay. The other thing I don't do is this concept of, oh, you've only got so long and you've only got so long. Okay. Life is different for everyone. Okay. It's one day at a time. I think my kids get so sick of me. Carolisms, one day at a time. Tomorrow's the first day. Write it down. Show me the data. But the issue is that you really have to take each one of us each day at a time. Work out how we're going to get through it, how we're going to what are fun things we're doing? Whether it's listening to music, definitely exercise, what art, okay? All those things are important to make sure we can get through our day as best we can with whatever chronic we have to deal with. That's my take.
Thank you very much, Prof. And I think that answers that aspect completely. The next question is two different parts that are rolled together. And the first aspect is very clinical, when the second aspect leans very much towards survivorship. So we have a history here of a triple negative breast cancer with a double mastectomy. They wanted to know what the recommended monitoring schedule would be to look out for recurrences or secondary cancers. Then it goes on to ask, what advice would you have for returning to the office work while dealing with neuropathy and general weakness post-surgery?
So I'm going to say, firstly, I don't want these things to be about, it's not clinical consult, but I'm going to say that most people today, we don't advise bilateral mastectomies on. When you're in cancer treatment, you want from an enhanced response after surgery, you want smaller surgeries possible. You can do risk reduction going forward. But if you've had a bilateral mastectomy, you're going to need ultrasounds. There are local ways to check, and there are systemic ways. Local ways would be your sonars. Systemic ways would be with your oncologist to do your scans. Survivorship has changed where it used to be, geez, I remember sitting in Joburg Gen at the clinic having to fill out forms for CT scans and chest x-rays every 3 to 6 months. Now we ask people to listen to your body. And if you have a symptom, you go for your checks. So rule of twos, if you've had the symptom for over 2 weeks, see a doctor and then make sure that they run some tests. Right. Okay. That was on the bilateral mastectomy. In terms of neuropathy and return to work, this is where occupational health is critically important. So your work environment, people need to understand that it's the blast, it's the Captain Marvel. There are things you can do and there are things you can't do. Your survivorship team will help you managing exhaustion, managing how you can work in your environment with what you've been through. And it is difficult with neuropathies and battling to walk. I really think sensible shoes. I look in admiration at these ladies with these nice high shoes, red bottoms, this exact. I live in tackies, work on function. Otherwise, I have a sensory neuropathy in my feet. So you have to be able to make sure that you're being sensible so you don't trip and fall. And people need to work out how you can manage your workday. But that is where OT plays a huge role, occupational therapy, and understanding what your occupational health assessment is. Right?
I'm not sure if
Yeah,
Dr.
and
Hart or Dr. McCrindle want to contribute as well to that discussion.
I would just contribute in that if the neuropathy was severe enough that they needed some medication, we use some nerve blocking medication. We use vitamin B to help those nerves just not be as sensitive and recover. But I would also definitely be referring either to an occupational therapist or a physiotherapist who's familiar with oncology and peripheral neuropathy.
Yeah, I also, I mean, that's something I can also help people talk through is what they can and can't do and how they can find solutions to it. We also have an occupational therapist in the survivorship in the team. So yeah, we've got people that can help for sure.
Thank you so much. There have been some suggestions that have come through about future topics for webinars, and I'm going to make sure that we keep a note of them and we include them on a discussion internally going forward. I also welcome either of you to discuss very briefly this aspect of a webinar. So the first one that comes through is the controversial topic of HRT for breast cancer survivors. And they mention that there's a lot of conflicting advice out there, even amongst the medical community, and that it's hard to balance the risk against quality of life with so many unknowns. What do you think of that as a topic going forward?
I think it's a great topic. I was at ASCO now in June, and there was a nice study looking at using progesterone. And you know what? I think if Devin was on there, he'd tell you in the early 2000s, we used to use high-dose Provera in our cancer patients to manage their side effects. So this is not new. Okay. And there was a presentation on looking at decreasing flashes. I think that issues are not topics and things change and medicine changes over time. And you've often heard me say that maybe in 5 or 10 years, we're not going to be operating on so many patients and things will change over time as medicine does. It's about working out each risk to individual persons and what you can and can't do. So there's no reason why some people can't take HRT, but it may be that most people don't need to. It's working out for you, and this is around each person a consultation about what's the best option. What I do think is having it as a topic, absolutely happy. And I think, Dom, you'll remember Judith did an amazing Teams meeting in the academic aspect of our MDM on this, and we can speak to her, and happy to have that as a topic.
Absolutely.
Something is only controversial when it is spoken about hush hush behind closed doors. When you bring it out, you go over options, and it's always T's and C's applies to each individual person. And again, this is not about a consultation per person, but this is about discussing a topic. And remember, data changes. So what we did, surprisingly enough, 20 years ago, we are now doing again with breast cancer, low dose progesterone, but different aspects around this topic. Lovely idea.
I welcome any aspects of comment or if anyone wants to have a small discussion on HRT now, if there's any further contributions.
Yeah, I think it's a big topic, and it's very being talked about a lot these days on social media and within academic circles, etc. So I think that it does need to be a topic on its own, but we are open just on that. We want to do these monthly webinars. We've got sort of the next 4 topics we think, starting with nutrition in oncology in 2 weeks' time, and thereafter they'll be monthly. And we will cover, I think, next after that, exercise in oncology patients. We will cover stress management. We will cover healthy sleep. And then we are so open to what the need is. So we, if you share in the comments or email Dominic at the BCCE, we'd be happy to organize other topics going forward and find appropriate specialist speakers on the topic.
Yes, I think there's so many topics. Sorry, Dom. Yeah. There's so many topics, and we wanted to start with the basics and then expand from there. But really, you know, we can carry on like this for 10 years, me and Lorna. So yeah.
Definitely. On that note, I am going to mention the other topic suggestion that came through from the chat was on the pillars of stress management and somatic modalities of tension and trauma releasing exercises. These are all topics that we will take into account, that we will include in our discussions. And I know exercise is already a topic on one of the pillars that we are planning to have a webinar in, and including those suggestions as preemptive questions for that webinar, we will make sure we'll do that as well. I think we've had a lovely discussion on interaction with our audience, and I'd like to go to a comment that Dr. Hart mentioned earlier that I think would be beneficial to have a brief discussion on. And you mentioned how caregivers and their integration into the survivorship plan. I wanted to know how important structured survivorship care plans are and what essential elements are that need to be included in such a care plan.
Are you talking specifically about the caregiver side, Dom? Sorry, is that
if we can all bracket it both in terms of making this survivorship care plan, and maybe for someone who is a caregiver and is trying to perform their own survivorship care plan, as a coach who probably has more experience than anyone else creating these sort of care plans, what are the essential elements that need to be included or looked at?
Well, firstly, obviously, you have to look at the medical, what are the medical requirements of treating this cancer, you know, and so everything else has to fit in around that. and then so you obviously look at, okay, what are the, kind of getting your head around the whole process of what's going to happen next is the place that you have to start. But then, that's where Lorna and I then come in, is, okay, so what else are you going to be dealing with here? And then, do you need help with that? And that's what we're here for, is to help with the different aspects of that. And if you're struggling to balance things, and if you're struggling to work out, how you're going to manage this, etc., then that's what we're here for as well. And then, from the caregiver's point of view, caregivers need to look after themselves as well. It's hugely stressful to think that your partner, the most important person in your life, for example, might have a life-threatening disease. So that is a hugely stressful position to be in. And I know a lot of them, obviously want to do their best for this person, but they also have to look after themselves so that they can be a pillar of strength. And so, I have spoken to caregivers as well, and had consultations with them too, just so that they can work out the best ways of supporting their partner, or the person that they're caring for. So I do think that caregivers need support as well. And I think what Lorna said earlier about having the right people around you is just as important for them as it is for the cancer patient.
Thank you very much for that. So something that was also very interesting for me that came up earlier is how both Dr. McCrindle and Prof. Ben spoke about this new research or evidence that came out. And I did see, I posted in the chat a number of these discussions that came out just in 2025 on sleep promoting cancer. Is there any other emerging research or innovations that are coming out in survivorship that excite you as specialists specifically involved in the survivorship care field?
Lorna?
So I think we are watching and waiting for new evidence to come through these new drugs that are used to help with weight loss and diabetes. I just know that they're showing sort of an anti-inflammatory. I'm talking about the GLP-1s, Ozempic, etc., which is obviously new drugs still, but these are obviously helping with weight loss, which we know is a risk factor for breast cancer, but they're also significantly decreasing inflammatory markers, and so there may be some studies that are done around cancer as well. My biggest interest at the moment is the sleep one.
I think both of those are super, super hot topics at the moment. So the third generation GLPs that they are going to research now, but there's clear data on that, and it's a bit chicken and the egg, but they decrease inflammation, so they definitely have an effect on decreasing your chance of developing cancer, but also helping with the weight loss and the diet, etc. Obviously, again, I always say T's and C's, not to be taken. It's like one of my things with oral contraceptive pills, that everyone just goes out there and just takes what they like. Any medication needs to be done under a doctor's consultation, proper review, and check to see around risks and benefits for any single person. Okay, that's whether you're taking vitamins and supplements or whether you're taking prescription medication. So no question, the data on that is looking super exciting. Data on exercise is looking exciting, and sleep, as well as I'm still desperately waiting. There's a nice release of medication to help with hot flushes around, and that might decrease the conversation so much about HRT and utilization for cancer, even in risk reduction. Low dose HRT with the use of AIs or tamoxifen has been around for many years, studied in Italy, etc., etc., etc. So there's lots of exciting things out. As with any field, whether it be cancer treatment or whether it be survivorship, it's evolving all the time. And the issue is having the conversation out there to make sure that we are aware of what the problems are and that we come up with sensible solutions. And again, these conversations are about discussing a topic and the consultation around that topic is had with your physician.
Thank you, Prof. Ben. And before I move on to last little aspects, I know you are quite firm on not devolving these webinars into direct clinical discussions. However, I do want to give you the chance just to put one comment on a question that comes through about whether a luminal ER/PR positive breast cancer with infiltrating ductal cancer, would the recommendation be double mastectomy? And I know you are quite firm on that, but would you like to address that?
Absolutely not. Okay. So less is more around surgery. Once something's in the bucket, you can't put it back. Always do less is more. You can always come back, do more is more, but you don't go around and do a double mastectomy to treat uh, almost any cancer today. The last great stand is on the inflammatory cancers, and I'm looking forward to Dr. Vandenberg's work and research on that, which is super amazing. But really, 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 you know, life is about consent small, less is more, and then you go forward from there. So yes, if you look at the St. Gallen consensus and you look at the NCCN, they'll say that if you're a young patient, absolutely you can have a bilateral mastectomy. If you're a BRCA patient, etc., absolutely. And we often have people coming in and going, "This is what I want," and we document it in the file, and this is what I want. Okay, but we always, and since time before, have tried to explain to patients that you can start small, etc. Sometimes from a logistic issues, people think bilateral mastectomies, and in the old days, we used to sentinel up front to check that they didn't need radiation and then do it. Okay, but nowadays, what we do is we really, really want to probably do smaller surgery, and we know that the survival on a breast saving and radiation is probably better than a mastectomy. So, yeah, go small. Don't watch that song, Go Big or Go Home. Don't do that, okay?
Thank you very much, Prof. And then the question has finally come out that I've been expecting to appear the whole evening, and I'm going to let both Dr. Hart and Dr. McCrindle handle this, and it's regarding medical aid and survivorship and the integration there. What is the situation with that, and what is on offer?
Yes, this is a big thing, and we get, we are pioneers, I have to say, in survivorship, and so we do not have medical aid cover specifically for survivorship yet. I mean, in our opinion, it should be coming out of the oncology benefit. It doesn't. Because we are both medical doctors, we have practice numbers, and of course, we can claim, you can claim from your medical aid for consultations with us, and that they will cover it as a kind of a general practitioner kind of consultation. But, this is our goal is really, with all the research and so on that we plan to do with this program, and what we plan to publish, is to actually provide medical aids with concrete evidence that this is absolutely vital in improving patient outcomes and improving patient compliance, etc. So we really want to be able to go to the discoveries and so on of the world and show them the evidence. And then, but that's going to take us a little bit of time, but that's where we're aiming to go, for sure.
Thank you so much. So that does seem that there is some good news on the horizon.
We hope so.
Yeah.
Fantastic. I'm going to start winding off tonight's discussions. We've been going on for about an hour and 20 minutes, and I think this is a great introduction to the start of where we want survivorship to go, with a good focus on that there are going to be a number of very focused webinars in the future, whether that be on diets or whether that be on exercise. We are going to have some very narrow scoped but deep discussions on this. What I do like to end off our evenings with is a bit of a final thoughts and a key message from each one of our speakers. I'm going to do it a little bit different tonight because I'd like two different thoughts from each of you coming forward for two very different audiences. I'd like a key message or a bit of advice that our clinicians can take from specialists in survivorships about how they can better support survivors in their practice from people who specialized in it. And then a second key message is a bit of advice to our cancer survivors or even their key caregivers. I'll give you a moment or two to think and address that. And perhaps we start off by Prof. Ben. I'll put you on the spot, and if you want to answer those final two questions for me.
Yeah, it's actually on my phone, so I'm going to go over it. Okay, so what do I think? I think that way too few clinicians utilize survivorship specialists. We tend to be clinical, we just go through. So that's why webinars are so important for me, because I think patients need to drive the change to say, oh, hold on a moment. And you may not have time, but I need referral in and help with A, B, C, D, E. I think that's important. So if you're not getting it from your clinician, you need to ask. You need to, your body, your health, you need to take responsibility and say, hold on a minute. This is my needs analysis. That's very important. What was the question two?
Question two, it was almost asking the same question, one directed towards clinicians and one directed towards patients. And I see you kind of incorporated your answer to do both of them, that we want our patients to be aware of survivorship and to them to drive the push to their clinicians to be part of their care and part of their care plans.
Totally. You know, it's your body and it's your responsibility. And we are here to help as best we can. But if we don't know what the need is, then we don't know how to help. And it may be that we don't have the facility to help, either with clinical knowledge or EQ or et cetera, et cetera. But if you ask, it behoves us to help find the right answer for you.
Thank you so much. Dr. Hart, I'm going to move on to you next, but I'm also going to give a fun little comment from the chat that we've had from someone who's on the board of a medical aid to see if we can get a bit of a heads up on the outcome of these improvements mentioned. Should they brace for impact now? And I think the comment from me is we do hope that you start bracing for impact now, because this is definitely something that needs to be included. Dr. Hart, what are your two messages? One for clinicians and one for our patients.
Yes, firstly, I'd like to say to clinicians that please don't assume that the oncology team that your patient is seeing, I'm not just in breast cancer, in any cancer, that oncology team really has a decent survivorship program. They probably don't. I think, as I say, our unit, I think, is quite unique. And so, you know, it's probably a good idea to inform yourself on what the survivorship needs are of patients. And Lorna and I really do hope to be part of educating GPs and people around this whole topic in the future. And then for survivors, I think Professor Ben sort of mentioned it, but as a survivor, take responsibility perhaps for kind of driving your own survivorship support. You know, you just keep on asking questions, keep on demanding help until you get what you need. You know, we have a website now. My website's heartreach.life, and you can actually go onto the website and link onto the you can send us a contact form there and book a consultation with us, and we can start helping you find the kind of help that you need.
Thank you so much for that. Dr. McCrindle, the same question for you.
Yeah, so to clinicians, particularly GPs who are managing patients, breast cancer survivors and their health needs, I just want to say, listen to the patient. I think doctors can commonly think, well, you've had cancer, you're through it, you're in remission, this is great, be grateful. But actually, because the ongoing niggles and needs are very, very real to the patient, and often something can be done. So I just want to say, even if you can't find anything on examination, listen to the patient. And then to patients, to breast cancer survivors, I always like to remember that there is meaning in suffering, and that your journey can be a light for someone else. So, yes, we want to help manage your needs and your symptoms and your struggles, but also to just remember that there are others as well who you might be a little bit further down the road than them, and you can share your story. So yeah, just reaching out to others and sharing some of your stuff with others, because it could be a light for them. Yeah.
Thank you very much for that. And thank you very much for everyone who has joined us this evening. This is, as we've said, our introduction to the Survivorship webinar series. And the plan is to have multiple focused webinars like this going forward. What we will be doing is we'll be posting tonight's discussion onto the Breast Care Center of Excellence YouTube channel. So if anyone does want to go through it and get any repeat information, or if you feel that there's someone that you know who might benefit from the discussion, you're welcome to do that. We will be taking all the comments into the chat into account, looking at the suggestions that have come through, looking at what questions were asked and what we can focus on, and we will develop our webinar plan even further based on the responses going forward. As was mentioned earlier, we do have our first discussion on the 6 pillars that have been mentioned coming up now in the first week of August. It's not even 2 weeks away from now. We will be providing those links on all the social media sites as well. What we will also do is everyone who has attended tonight's webinar will get a direct invitation to sign up for that one. So that will be coming through to whatever email address you registered and signed up for tonight's webinar. We thank you to everyone, and we specifically thank you to Dr. Hart and Dr. McCrindle, who are spearheading this new survivorship webinar aspect. I have received some questions for access to the transcript and access to that. Within a week from today, you will be able to have access to all the recordings and everything that has been discussed tonight. Thank you everyone for your time tonight, and we hope to see you at all the future webinars.
Thanks so much, Dom.
Thank you, Dom.
Thanks, Dom.
Thank you. Good night, everybody.
Night.
Bye.